Good morning, everyone, and welcome to the 2024 Filipino Nursing Diaspora Day. I am Jofred Martinez, your host for today's webinar titled Bayanihan, All Hands on Deck for Global Health. And this year's theme, Respecting Rights to Secure Global Health, emphasizes the universal importance of healthcare rights and access, aligning with our dedication to advancing healthcare globally. Today, we will delve into significant challenges that our Filipino nursing community faces in advocating for health as a fundamental human right and discuss the global and local impacts on healthcare access and health equity. Let us honor our heritage with the Philippine National Anthem, followed by an ecumenical prayer. Please rise if you are able.
In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Our most gracious Heavenly Father, we come to you today to praise and worship you and give you thanks for all the things you continue to provide for ourselves and our families. Father, we humbly ask for forgiveness for all the times you have offended you. Continue to guide and protect us, Lord. Bestow upon us your unending grace and healing, that we may in turn become instruments of gentleness and compassion to others. We ask all this in the name of your Son, our Lord Jesus Christ, with prayer and intercession of our Blessed Mother. Amen.
Bismillahirrahmanirrahim. اللهم إياك نعبد وإياك نستعين اللهم اهدنا الصراط المستقيم اللهم وحد صفوفنا بين المسلمين والنصارى واللوماد إلى صراطك المستقيم اللهم امنحهم العيش بالأمن والسلامة والتنمية المستدامة في مدينة دافاو اللهم لا تزغ قلوبنا بعد إذ هديتنا وهب لنا من لدنك رحمة إنك أنت الوهاب ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار والحمد لله رب العالمين.
Amoynen manama kami gimot tolangon, manotod kakaroson no, si koikaw kami tokul tolangon, way migtumpi to tano, si koikaw kami bohoy to kopianan tolangon na maotaw, pusako kapusung no, kana akong to pabulos koy, o agbuyo koy ko, way bohoy kat pabur, kahalaan, kalinaw, to kanami, no pag-ugpo, way kasabok kakoy, oyot kalambukan. Kay kuro tamana kakodin panubado ay pag-ampo, kaupianan igboy no, way kakoy kong imono, way kahalaan ko lang.
We are thrilled to have almost 10,000 registered participants joining us today via the Zoom webinar platform and Facebook Live. Your presence and engagement are greatly appreciated. We would also like to acknowledge the government officials and nursing leaders who have graciously provided their messages and greetings. Our sincerest thanks to President Ferdinand Marcos Jr., Vice President Sara Duterte, Senators Loren Legarda and Bongo, as well as our esteemed international and national nursing leaders. Before we proceed, I would like to share a few reminders about webinar etiquette. As this is a CPD activity, attendance for the entire webinar is mandatory. For those joining via Zoom webinar, your attendance will be automatically monitored. If you are joining via Facebook Live, please complete the attendance form using the provided Google Form link. CPD certificates will only be issued to participants who have attended the entire webinar. If you have questions for our speakers, please use the Q&A button to submit them. We kindly ask that you avoid posting messages and questions about certificates and evaluations while the speakers are presenting. Let us also maintain a courteous and professional environment in the chat and Q&A sections. Thank you very much. I would now like to introduce our esteemed speakers who will be giving their welcome messages. Each represents a cornerstone of our community and brings a wealth of experience and insight. Please welcome Professor Violeta A. Lopez, President of the Filipino Nursing Diaspora Network.
Good morning, ladies and gentlemen, and colleagues and distinguished guests. On behalf of the Filipino Nursing Diaspora Network, it is my utmost honor and privilege, and I am filled with immense pride and gratitude for the opportunity to welcome you all to this webinar with the theme Bayanihan on Hands on Deck for Global Health. Today is also part of the week-long International Nurses Week with the theme Nurses Make a Difference Everywhere, Anytime, Anywhere, and Always. May 12 also commemorate the birth of Florence Nightingale. This webinar marks a significant milestone of our collaboration and collective effort towards advancing the nursing profession, not only in the Philippines, but across borders and beyond boundaries. It is a testament to the unwavering dedication, resilience, and innovation of Filipino nurses who have made enduring contribution to healthcare excellence globally. As we embark on our nursing journey today and over the coming years, we are presented with a unique opportunity to engage in meaningful dialogues, exchange ideas, and foster collaboration that will shape the future of nursing practice, education, and research. By connecting with the Filipino Nursing Diaspora Network members globally, our collaboration with this webinar serves as a platform for us to celebrate our successes, address our challenges, and explore innovative solutions to the pressing issues facing our profession. Throughout this webinar, we will have the privilege to hearing from distinguished speakers and leaders in the field of nursing. We will delve into critical topics of what Bayanihan means to all of us and how we nurses can make a difference in global health, addressing equity, diversity, and inclusion for all. As we navigate the complexities of our ever-evolving healthcare landscape, let us remain steadfast in our commitment to uphold the highest standards of nursing excellence, compassion, and professionalism. Let us harness the collective power to create a brighter and more equitable future for all. In closing, I would like to express my heartfelt gratitude to St. Anthony's College, Pacific Nursing Organization Incorporated, Philippine Nurses Association Region 6, and the Association of Deans of Philippine Colleges of Nursing, sponsors, partners, and organizers for this unwavering support and dedication in making this webinar a reality. I extend my warmest welcome to each and every one of you and wish you a truly enriching and inspiring experience at the Filipino Nursing Diaspora webinar today. Remember the ICN theme for this Nurses Week? Nurses make a difference every day, anytime, anywhere, and always. Thank you. Mabuhay ang Filipino nurses.
Thank you very much, Professor Violeta A. Lopez, President of the Filipino Nursing Diaspora Network. Following her, we have Dr. Rosana Grace Bello de la Riarte, Governor of PNA Region 6 and Chair of the PNA Board of Governors.
A pleasant good morning to all. I bring these greetings from the Regional Council of PNA Region 6 and from the Board of Governors of the Philippine Nurses Association Incorporated. It is with pleasure that I welcome each and everyone to the Filipino Diaspora Day with the theme Bayanihan, All Hands on Deck for Global Health. In the light of continuous changes and greater demands in healthcare delivery, it is important for the nurses to keep abreast with developments in global health that will further promote quality health outcomes in the care of individuals, families, population groups, and communities. Bayanihan is a wonderful Filipino word which literally means being a bayan and is thus used to refer to a spirit of community unity and cooperation. Indeed, achieving global health is a shared responsibility. It demands a collaborative effort, unity, and cooperation from governments, international organizations, communities, NGOs, and the private sector. By working together, we can build a stronger health system, tackle existing and emerging health threats, and ensure a healthier future for all. Only with all hands on deck can we create a world where good health is not a privilege but a right. This webinar will provide a wonderful forum for us to be informed and help us identify and address important matters in global health development in the context of healthcare and nursing through Bayanihan. With an impressive roster of distinguished resource speakers, this year's Filipino Diaspora Day celebration promises to be an informative and productive platform for comprehensive discourse on the evolving landscape of global health and the nursing profession's pivotal role in navigating these challenges. Rest assured that the Philippine Nurses Association will remain committed in upholding its partnership with the Filipino Nursing Diaspora Network and will always be supportive of endeavors such as this. I wish you a fruitful conference. Mabuhay!
Thank you very much, Dr. Rosana Grace Bello de la Riarte, Governor of PNA Region 6, as well as the Chair of the PNA Board of Governors. And our final welcome message will be from Dean Tony Ann Bilachica, Nursing Dean of the University of St. La Salle Bacolod and President-elect of ADPCN Region 6.
To Dr. Violeta A. Lopez, President, Filipino Nursing Diaspora Network, to our highly respectable nurse leaders, officers of the Filipino Nursing Diaspora Network, esteemed colleagues, ladies and gentlemen, a warm and heartfelt welcome to each and everyone. On behalf of the Association of Deans, Philippine Colleges of Nursing, it is with immense joy and pride to extend my sincerest greetings to our nursing heroes gathered here today. In times like these, where the world faces unprecedented challenges, the significance of nurses in healthcare cannot be overstated. You are the unsung heroes on the front lines, the compassionate caregivers who tirelessly dedicate yourselves to the well-being of others. Your unwavering commitment to providing quality care is the cornerstone of the global healthcare system. And for that, we are deeply grateful. To our well-admired Filipino nurses, I want to express my profound appreciation for your remarkable contributions. Many of you have left the comforts of home, braving unfamiliar territories to serve in distant lands. Your sacrifices, your resilience, and your unwavering dedication exemplify the true spirit of bayanihan, the Filipino value of communal unity and solidarity. Your presence transcends borders, embodying the essence of unity in diversity. And for that, we salute you. Today, as we come together for this webinar, let us celebrate the spirit of collaboration and learning. I extend as well my heartfelt gratitude to our distinguished keynote speaker, whose wisdom and expertise will undoubtedly inspire, motivate, and enlighten us all. Let us seize this opportunity to glean insights, share experiences, and strengthen our resolve to continue our noble profession amidst the difficulties we face. May this webinar be a source of empowerment and camaraderie. Together, let us reaffirm our commitment to excellence in nursing, knowing that through our collective efforts, we can overcome any obstacle that lies ahead. May God bless each and every one of us as we embark on this journey together. Mabuhay ang mga Filipino nurses. Maraming salamat po. Magandang araw sa inyong lahat. And again, Happy Filipino Nursing Diaspora Day.
Thank you very much, Dean Tony Ann de la Chica, Nursing Dean of the University of St. La Salle, Bacolod, and President-elect of ADPCN Region 6. As mentioned, we have over 10,000 participants who registered for this event. And as of now, we have 1,300 participants watching us via Facebook Live and here in our Zoom platform. At this point, let us recognize our participants coming all over from the Philippines and, of course, all over the world. So please use our chat box to type in your location wherever you are in the country or wherever you are in the world, and we'll be acknowledged some of you. So again, we would like to request our participants to please chat. We have participants coming from Iloilo City, Cebu, Zamboanga, Rojas, Bulacan, La Union, Antipolo, Zambales, Palawan, Zamboanga, Antipolo, Cainta, Bataan, Bohol, Olongapo, Cebu, General Santos City, Nueva Ecija from Guimaras. We also have from Calbayog City in Samar. From Pangasinan, we have from New Zealand, from Davao City, from Tagum, Davao del Norte, Parañaque, Iloilo City. We have from Bulacan. We have also from Aklan, Binangonan, Rizal, Abra, and from Quirino Province, and all the way from Baguio. Here also joining us via Zoom platform, we have our participants coming from Iloilo. And we have from Tuguegarao City, Ibahay, Aklan, Cotabato, and Iloilo. So most of our participants are from the Philippines, almost all provinces of the Philippines. Again, we're expecting over 10,000 participants to join us in our webinar for today. So again, before we proceed, we would like to remind everyone that this is a CPD activity. So attendance for the entire webinar is mandatory. For those joining via Zoom webinar, your attendance will be automatically monitored. If you're joining via Facebook Live, please complete the attendance form using the provided Google Form link. And CPD certificates will only be issued to participants who have attended the entire webinar. At this point, to introduce our keynote speaker, let us listen to Dr. Sherwin S. Wallace, Chief Nurse of Angel Salazar Memorial General Hospital and PNA Antique Board of Director.
Good morning. Good morning, everyone. Our keynote speaker for this morning is the Nurse Scientist and Magnet Program Director at Providence St. John's Health in Santa Monica, California. He is a lieutenant colonel in the U.S. Air Force Reserve and is currently assigned at the 452nd Aerospace Squadron at March Air Reserve Base in California. He is the president-elect of the Philippine Nurses Association of America for 2022 to 2024. He is a bachelor's degree in nursing from the University of the Philippines and a Master of Science in Nursing and a Doctor of Philosophy from the University of California in Los Angeles. He received a Master's in Military Operational Art and Science from Air University, U.S. Air Force. He is a board certified as an oncology nurse, oncology clinical nurse specialist, advanced nurse executive, and nurse professional development specialist. He is also a Calderon Senior Nurse Executive Fellow at Case Western Reserve University's Marian K. Hosheni Nurse Leadership Academy at the Frances Payne Bolton School of Nursing. He held educational research and leadership roles in various settings. He was previously the clinical nurse specialist for oncology and blood and marrow transplant at the University of California, San Diego Medical Center. He also held a position as a nurse researcher and administrator for Neuro-Oncology Department, where he was instrumental in growing the first dedicated neuro-oncology program in San Diego County. He was a summer intramural research program fellow at the National Institutes for Nursing Research, National Institutes for Health, and was appointed as the visiting researcher at Chiba University School of Nursing in Japan. He is a lecturer at the University of the Philippines Open University. He is also one of the co-investigators and founding members of the Brain Cancer Quality of Life Collaborative at Los Angeles Cancer Caregiver Consortium. He is a section editor of the core curriculum for oncology nursing and has published multiple papers and book chapters. He is a fellow of the American Nursing Academy and received several awards and distinction for the Oncology Nursing Society, the Global Caring Foundation, the University of the Philippines International Nursing and Healthcare Forum, the University of the Philippines Nursing Alumni Association International, the Philippine Oncology Nursing Association, and has served multiple leadership and advisory roles in several professional, community, and social civic organizations. Ladies and gentlemen, please welcome our keynote speaker for this morning, Lieutenant Colonel Marlon Garzo Saria, U.S. Air Force Reserve.
Thank you, Dr. Wallace. That was a very long introduction, but thank you. I would like to make a disclaimer to the participants. The 5 minutes that he read the introduction does not count towards your CPD hours for today. I'm kidding. No, I really appreciate being invited to this event. Happy Filipino Nursing Diaspora Day. Happy Nurses Week. We are still in the middle of Nurses Week. And then those of us here in the US, it is also Asian American Pacific Islander Month. And so we have a lot of celebrations this month. It will be Hospital Week next week as well. I am really honored to be here to Professor Violeta Lopez, President of the Philippine Nursing Diaspora Network, Dr. Rosana Bello de la Riarte, Chair of the PNA Board of Governors, Dean Tony Ann Lachica, President-elect ADPCN Region 6. Thank you for those warm welcomes for the participants. Also would like to thank Dr. Jerome Babate and Dean Aris Bungabong for the invitation. So let me try to share my screen, and forgive me if I mess this up. I have not shared a PowerPoint on Zoom in a long time. We've been using Microsoft Teams here. Oh, perfect. Here we go. All right, I think I got it right. Can you see my screen? All right. So the topic, our theme for today's webinar, Bayanihan, all hands on deck for global health. Bayanihan and all hands on deck basically mean the same thing, used in different contexts. Bayanihan is what we use in our Filipino culture to talk about Filipinos working together towards a common good, supporting, advocating, helping our fellow countrymen, each other. All hands on deck is mostly used on ships, sailor, navy, talking about needing everyone's help in the event of calamities or disasters. So, Bayanihan, all hands on deck for global health. It really is a call for all of us Filipino nurses all across the globe, to work together as one, regardless of where we are and regardless of the cultures that we're serving, the countries, the populations that we serve, to impact global health. We are in a crisis. Regardless of what country you are in right now, there is a global healthcare crisis, and I will talk more about that. I also love the theme of the Filipino Nursing Diaspora Day 2024, respecting rights to secure global health. And I will talk about human rights and health as a human right, as a concept in the first couple of slides during the introduction. I have a disclaimer. I will not read this entire paragraph, but I want everyone to know that whatever you hear from me today are my own opinions, not of the Air Forces, not of my employer, Providence St. John's Health Center, and not of the Philippine Nursing Association. And also, one of the most important disclaimers that I always say at platforms like this, where we have an international audience, where we work in different countries, different cultures, different legislations, different laws, that I am speaking from my experience working in the United States of America and as a Filipino. I lived in the Philippines for 21 years. I am 46 right now, so I've lived most of the second half of my life already here in the United States. So if I mention some of the things that I remember, practices from the Philippines, that is because of that. That I've been in the Philippines over 20 years ago, and then most of my adult life I have lived here in the US. Hopefully we will have time at the end to open the floor up for discussions and talk about specific issues and specific challenges and maybe specific successes from the different countries where we see Filipino nurses. I recently was at a retreat 2 weeks ago, and it was a retreat on self-care, and the premise was we as nurse executives and nurse managers will not be able to take care of others, will not be able to take care of our staff so that our staff can take care of our patients if we don't take care of ourselves first. And one of the first exercise that we did was to list our priorities and rank them in order. So I am offering this up to you. Job, parents, if you still have them, child or children, if you have them, spouse, if you have one, church or spirituality, health, and hobbies. If I ask you to rank them in order, what would be your top priority? I asked this at a conference that I presented at this morning. And when I told them that my top priority is health, they were nodding their heads. Many of them chose their spouse. Many of them chose their kids, especially those who have them as their priorities. But my argument for choosing health was the same argument that I said earlier. We will not be able to take care of our spouses, our children, our aging parents, if we ourselves are not healthy. So health and our own health should be our number one priority so that we could be of better service for others. Is that your priority? The litmus test of your priority is, where do you spend most of your time in? Just think about a 24-hour day, a 24-hour workday. Where do you spend most of your time during a 24-hour workday? 8 to 12 hours at work, maybe 1 to 2 hours in commute. You get home, you have a few minutes, hours to talk to your spouse, talk to your kids, take your kids to school. Look at those hours, look at the time you spend every day. What percentage of your 24 hours a day do you spend on your health? We're talking about global health and how nurses can impact global health. But the most important question is, how can nurses impact our own health? Because our own health is important, is more significant, because without our health, we will not be able to serve. Talking about health, health is a fundamental human right. And I have a excerpt here from the Constitution of the World Health Organization, first published in 1946. The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being. Now, if we dissect this statement, highest attainable standard of health, that will be different for all of us. We have non-modifiable risk factors that may limit the highest attainable standard of health for us as individuals. But there are also modifiable risk factors that we can fix so that we can improve the highest attainable standard of health for human beings. The preamble, Constitution of the World Health Organization, has defined health. And I know that you're all very familiar with this. We all have learned this in nursing school. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And then going back to that definition of highest attainable standard of health as a fundamental right of every human being, there should be no distinction related to race, religion, country of birth, political belief, economic, or social condition. Health as a human right is also encoded in the Universal Declaration of Human Rights, published in 1948, and was also subsequently enshrined in the International Covenant on Economic, Social, and Cultural Rights in 1996. Healthcare is a human right. How many of you believe that healthcare is a human right? For those of you who have been to the US, those of you who may have followed the political conversations in the US, the United States remains the only high-income nation in the world without universal access to healthcare. And universal access to healthcare is how we define health being a human right. Not in the US. The US government only accepts some responsibility for the provision of care. US government will pay and will provide health care for those in prison and all the mental health facilities in the country, and also for the military. There is a conversation very much guided by political beliefs as to whether every citizen of the United States should have access to universal health care, and that conversation is ongoing. Where's that conversation coming from? Where's the argument coming from? So here, I listed some of the issues, and some of this may be applicable to some of our fellow nurses here from other countries. Healthcare is really difficult to define. Healthcare includes preventative care. For example, the immunizations that we give to prevent diseases. Healthcare includes public health measures. And I will go off on a tangent here. I am a very proud Bachelor of Science in Nursing graduate from the Philippines. And even to this day, I am proud and I promote our community health centers and our public health nursing to my colleagues here in the United States. I still believe that what we have in the Philippines is a strong model for the rest of the world to emulate. There may be some room for improvement, but I have not seen that structure anywhere else. Health promotion also is included in the trajectory of healthcare, and then medical and surgical treatment of established illnesses after diagnosis. So the question here is the so-called human right to health a right to basic provision of clean water and adequate food? We remember Maslow's hierarchy. Or does everyone in the world, if health is indeed a human right, have access to healthcare services, including organ transplantation, cosmetic surgery, infertility treatment, and the most expensive medicine? Also, the other part of the argument to healthcare being a human right is if it is a universal human right, then it implies that there's a duty on part of others. And by others, I'm talking about the governments who may provide the care. So would they be responsible in providing universal healthcare for everyone? What about the healthcare providers, our physicians, our nurses, us, our group? On whom does the duty to provide healthcare to all the world's citizens fall? Is it a duty on individual doctors or hospital authorities, governments, or only the rich governments? And also with migration, cross-migration, lots of travel across borders. If you get sick in another country, who will be responsible for your health if you're not a citizen of that country? If healthcare is a human right, we should be able to have access to healthcare wherever we are in the world and whatever our status is. So those are some of the complications why, at least for Americans, it is very difficult to define and to agree upon that healthcare is indeed a basic human right. Now, briefly, I just want to talk about the nursing social contract. This is one of the key messages that I give our new grad nurses when we train them to become independent practicing nurses at our organization. When you get your nursing license, as soon as you receive your nursing license, you sign that social contract that we have a responsibility for the development of individual and community health. We have a responsibility for the development of individual and community health. That is a very big responsibility that is on our shoulders as healthcare providers and healthcare professionals. So this is an example of all hands on deck. You see every single sailor pulling that rope. I'm assuming it's attached to an anchor of the ship. This is what we need. We all need our strengths to pull the rope together to address health equity and improve care globally. When we talk about health equity, there are some words that we will hear often. Built environment, that is the human-made environment where people live, work, and play each day. How does that impact health equity? I'll give you a couple of examples. I live in Santa Monica, California. I'm 2 blocks away from a very expensive food store, grocery store, Whole Foods. Some of my colleagues call it whole paycheck because it's very expensive. But that's how Santa Monica is. We have a community that prefers expensive, well, maybe not the expensive, but prefers those grocery stores where they are guaranteed of the freshness of the food, the everyday food and groceries that they buy. That does not exist in other areas, even within Los Angeles. In my city, we have pedestrian walkways where I can run every day. How many cities don't have that infrastructure for people to stay healthy, for people to work out? I was just in the Philippines in January in Iloilo. Iloilo is a very beautiful city. And I loved running outdoors in Iloilo because of this infrastructure that they have. How many of you could think of cities where there's probably not a place to run? Cities that are too congested to build areas where we can be healthy, we can go out to work and play. One of the things that I also noticed from the Philippines, and I've seen that in some of the metropolitan cities here in the US as well, is the infrastructure that is not conducive for people with disabilities. How many of you have driven, and I've only lived in Manila for the 21 years that I was in the Philippines, along EDSA? If you have an older family member who needs a wheelchair, how easy would it be for them to cross EDSA to go to the other side of the street? That is the built environment that I'm talking about that contributes to health equity. Disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health. Health equity is a state where everyone has an opportunity to be as healthy as possible. And inequity is the opposite of that. When factors like education, income, gender identity, environment, and ethnicity cause unfair differences in people's health. Public health is the science of protecting and improving the health of people and communities, and social determinants of health are the conditions in which people live, work, learn, and play, and they contribute to health inequalities. Health equity affects length of life. Here in the US, we say that our zip codes actually determine our ICD codes. ICD codes are diagnosis codes that we use for our patients. Another way to say that is where we live dictates how long we live. Let me repeat that. Where we live dictates how long we live. There has been studies upon studies looking at areas where mortality and morbidity is higher just because of the zip code that they're in and the structure of the community around them. Quality of life is also affected by health equity. Although quality of life is different for every single one of us. And for me, the best definition for me personally of quality of life is one from a dialogue of a movie that came out in 2007, The Bucket List, where the actors were having a conversation. And one of them asked the other and said, "Have you found joy in your life?" and the other guy was unable to answer that because he could not define what joy was. That to me says that he probably did not meet the quality of life according to his own definition. But then the person asking the question asked a second question. The first question was, did you find joy in your life? And have you given joy to others? That is the ultimate quality of life for me. Having fun and joy for me, and being able to share that with others. The rates of disease, disability, and death also is affected by health equity. We see this in many diseases. We see this in cancer. Cancer rates, disabilities from cancer, the severity of cancer related to how much we can afford cancer treatments, how often we can go and see the healthcare providers for appointments. We have those issues here as well, here in the United States, especially where I live in Santa Monica, where traffic is a huge issue. Patients are late for their appointment gets canceled. Access to treatment also is affected by health equity. And these are some of the things I'm talking very locally about the United States, but when we expand that globally, I'm sure you all have your own examples based on where you work of how health equity affects access to treatment. I have one story where I brought two of our physicians to the Philippines. We went to the Philippine General Hospital. I just realized that I should not have named the hospital. But this was standard of practice back then. This was over 10 years ago. We were in the OB gynecology ward. And then we were walking, just passing through the registration desk. And we overheard a conversation. At least I overheard a conversation because I could understand Tagalog, and the physicians that I was with could not. Patient had an appointment, but she forgot to bring sterile gloves for her physical exam. And they turned her away, basically asked her to buy sterile gloves before coming back for her appointment. I'm sure that's not happening anymore. That was 10 years ago. But that is a classic example of how health equity affects access to treatment. And I'm using an example from the Philippines from first-hand experience, but I also see that here in the United States. There are several examples that's very similar to that. We know that racial, ethnic, and may I add, gender minority groups are often disproportionately affected by health inequities. So let's take a pause for a moment. Let's ask ourselves these questions. Every time we go to a webinar, we go to a lecture, we have a lot of information getting dumped on us, but we don't really take the time to distill the information and have the information that was presented, apply that to where we are, where we live, where we work, apply to us in our practice. What are some of the few reasons, wherever you are in the world, why a person might not go to a provider? I'll be inclusive here. Let's mention providers instead of doctors. What are a few reasons why a person might not see a provider? Maybe a physician, maybe a nurse practitioner if you have them, maybe a dentist. Dentists, a really huge issue here in the United States. So I was introduced as an Air Force Lieutenant Colonel, and last year I volunteered to go on a medical and dental mission to Kentucky, one of the states here in the US. We were in a rural area, and we were there for 2 weeks. At 3 a.m., there's a line that forms outside the gymnasium of the school that we're at, seeking services from our dental providers. Many of the US citizens don't have access to dental care. It's very expensive. If you don't have a job, if you're not employed, you don't have a dental insurance. And even for those of us, and I'll speak for myself, I have a dual insurance from my private employer and from the US government. I still need to pay at least $1,000 if I needed a crown for my tooth. So just imagine what that cost is to someone in the rural area who doesn't have access to dental care. How far do you have to travel from your home to find a store that sells affordable fresh vegetables, meat, and fruit? Many of us may say that we have access to a lot of convenience stores, a lot of McDonald's, Wendy's, stores that generally are not known for selling healthy products, although they're trying, and they're trying very hard. Could you get there on foot? Or do you need public transportation? And how accessible is public transportation for you to be able to get to those stores? This is one of the two slides that really talk about health equity. And unless you've lived under a rock in the past 3 or 4 years, I'm sure you have seen a version of this. Health equity means that each person gets what they need to achieve optimal health. So you can see the difference between equality and equity on the image here that I have on the slide. Equality, everyone gets the same, right? Equality. So you see a person with disability getting the same sized bicycle as the 6'5" man and the 5'6" woman and the child in that image. At the bottom is equity, where everyone gets the bike that they need for them to be able to comfortably ride the bike. And you could tell that when we all have the bikes that are right sized for us, that we can travel forward longer. This is another picture, very much talking about the same thing. And I personally call this the parable of the boxes. Same thing. Earlier we talked about bicycles, but now we're talking about boxes. So with equality, if we're advocating for equality, we're advocating for everyone getting the same box. And you can see that that just does not work. Equity is getting the right number of boxes for what you need. But there's also a thing called social justice. Why do we have to give away boxes when we can remove the barrier, remove the wall, so that we will not need to even think about boxes and providing boxes to the population? But this is where we are right now. Those who have more gets more. Those who have less gets more taken away from them. I use this because this clearly explains equality versus equity and social justice. But there's a lot of things wrong with this picture as well. If you zoom beyond the foreground, beyond the 3 kids of different heights, what do you see? A soccer game. And beyond the soccer field, the stands where the audience are. Why do we have to keep these 3 kids behind the wall? Health equity, once we achieve it, means that these kids can be on the field playing soccer with the kids that they're watching. And or be at the stands, should they not want to play, they could watch from the stands. There's a lot of work ahead of us in terms of achieving health equity. The National Academy for Sciences, Engineering, and Medicine here in the United States published the second version of The Future of Nursing. The first version was The Future of Nursing 2020. Well, we did not meet the goals. So they wrote The Future of Nursing 2030, charting a path to achieve health equity. And just from that title alone, you could tell that the United States is not there yet. Charting a path to achieve health equity. We have not achieved health equity yet because we have not addressed the social determinants of health. Healthcare access and quality. Most of the major medical centers where you can receive tertiary care are still in major metropolitan cities. And I know that is true as well for the Philippines. That we have the PGHs, the St. Luke's, and the Makati Medical Centers, Lung Center, all concentrated within metropolitan Manila. We do have bigger hospitals and the other areas and other regions as well, and I see them coming up right now, but we're not quite there yet. There's still a lot of work ahead of us to improve access to healthcare and healthcare quality. Education access here in the US. As soon as couples start having kids, they move from inner cities, from apartments and residences close to work, to houses and apartments within a zone that has a good school district. You could talk to anyone from the United States, they will always talk about moving to a place where they have a good school district for their kids to go to school to. Think about that. Many of those of us in the audience here from other countries, I'm sure that's the same. You can try to find a good school district or a good school where you can send your children to. Social, economic, and community context also plays a factor in social determinants of health. Economic stability, availability of job within the area that you live in that does not require a 4-hour commute, and neighborhood and built environment, and I did talk about that earlier. So another pause here. How does education access and quality connect to other categories of the social determinants of health? I am a researcher, and we often look at level of education, educational attainment as a surrogate for socioeconomic status here in the United States. Level of education also infers the knowledge that they have in healthcare. Describe 4 reasons why someone might be unable to get medical care. I'm sure many of you will think about access to healthcare as number 1, and that's accurate, but there are many other reasons. You might have some of these examples in the countries that you work in. But here in the US, we have a public distrust of the medical system, especially after COVID and the issues related to COVID vaccination. I don't know if you'll believe me, but there are many people who don't even trust the Centers for Disease Control anymore and the statements that they release. It's very political. So those are some of the reasons, in addition to access to healthcare, in terms of why individuals may be unable to get medical care. For us here in the US, we have the National Institute of Nursing Research, and very recently, they revised their strategic plan. If you look at this strategic plan, it covers all the settings where nurses practice in communities, in schools, in homes, in workplaces, long-term care facilities, clinics, and hospitals. And they look at nursing research from the lens of, I love the analogy that they use here, from the lens of health equity and social determinants of health. So you can see those circles, the health equity and social determinants of health, as spotlights, shedding light on nursing research and research on population and community health systems and models of care and prevention and healthy promotion. So this is very hopeful for all of us here in the United States, that we're looking at how we do things through the eyes of research, to the eyes of practice, through the eyes, through the lens of health equity and social determinants of health. A very important article that I really do not have the time to talk about this morning, tonight for me, is this, published by Dr. Vincent Guillermo Ramos, Nurse-Led Approaches to Address Social Determinants of Health and to Advance Health Equity, a New Framework and Its Implications. So I have this here as a reference should you be interested in this work. And I'm down to my last few slides. How do we advocate for health equity, regardless of where we are in the world? I have a couple of recommendations here, and I'll go back to my disclaimer. These are Marlon's statements. These are not the Air Force's statements. These are not the Philippine Nursing Association statements, and these are not Providence St. John statements. First, we need to educate ourselves. How do we educate ourselves? By attending conferences, symposiums, webinars like this one that you're attending right now. There are also other platforms of educating ourselves, get to know other cultures, especially here in the United States. We have our Black and African American patients. We have our Hispanic patients. So how do I get to know about them? There are a lot of books. I will talk about having conversations with them when I go to number 2, listen. But for now, not just talking about educating ourselves, there's a lot of books that are available, and that provides a lot of information, a different way of knowing different ethnicities and cultures here in the United States. One of them is caste, referring to the Indian caste system. But this book by Isabel Wilkerson talks about the African Americans and how there was a caste system in the United States in the early 1900s that prevented African Americans from improving their ways of life. The Sum of Us is a book by Heather McGee. We all have thoughts, false beliefs that when we advocate for one group, we're taken away from another. Let me give you an example. And Filipinos really think about this. We don't like talking about ourselves. We don't like asking things for ourselves because we feel like we're taking things from others. But this book, The Sum of Us by Heather McGee, the basic premise is that is not true. And in fact, when you elevate one group up, you elevate the rest of us. We all rise up together. And then those of you who are interested, if you are interested to learn about Filipino nurses in the United States and the culture and history of the Filipino nurses in the United States, The Empire of Care by Dr. Catherine Seniza Choi. This was published in the 1980s. It's an older book, but still very relevant. Talks about why there are so many Filipino nurses here in the United States. And then basically in the prelogue of the book, she says, before the Filipino nurses came to the United States, Americans were in the Philippines first. They built this because they knew that they would need us. Those are some of the things, some of the books. There are many other out there that we could pick up and read to learn more about the patients we serve and the communities we serve. I know there are many other attendees here from different countries. Please share those books. I would love to hear about Australians as well, or maybe we have British nurses here who could talk about the different cultures in the UK. So I'm very curious about those, and then really would love to read more about different cultures. There are journals, articles. Nurse Leader from the American Organization of Nurse Leaders in their April 2024 issue. That entire issue is related to health equity. And then there are professional associations. So in the Philippines, I do hope that all the 10,000 registered attendees here in those of you who are in the Philippines are members of the Philippine Nursing Association. It really is very important to be a member of a professional association. It's very important for us to have a voice. Many of you may say that I don't have time for that. You don't really need to do a lot. Just sign up and be a member. And by being a member, you add to the collective voice of the Philippine Nursing Association. If you're in other countries, be a member of your local nursing associations as well. And if there's a Philippine Nursing Association in the country where you're at, sign up with them. Here in the United States, we have the Philippine Nursing Association of America, and we have an alliance with the National Council of Ethnic Minority Nursing Associations. We have regular conversations with the National Black Nurses Association, the National Association for Hispanic Nurses, the Asian American Pacific Islander Nursing Association, and the National Alaskan Native American Indian Nursing Association. Can you imagine how powerful that 5 organizations are when we all talk about elevate each other and advocate for each other? The Philippine Nursing Association stood up a diversity, equity, inclusion, belonging, and social justice task force. Why would PNAA need this? We're all Filipinos. Like, yes, we're all Filipinos, but we're all diverse. Like even within the Philippines, even within our own cultures, there's a lot of diversity. And diversity is not just limited to race and culture. Oops, sorry. We need to listen to others, share your stories. There's a wall in Santa Monica where I run every other day that says that our days and nights begin and ends as stories. Begins and ends as stories. And I believe that we all have stories to share. Like, how would your story today be? You could make that story better by sharing what you learned today to your colleagues, right? Let's share those stories. We have employee resource groups for the hospitals that we work at least here in California, where I am at. There is an Asian American Pacific Islander group. We have our Black employees resource group. I attend their meetings. They attend the Filipino group meetings. We learn from each other. A lot of what we know about other cultures really is very heavily impacted by individuals that we personally know. So the more you know about other cultures, the more you are related to them by connection, firsthand connection, the better you will be able to understand their culture. We need to start getting comfortable with uncomfortable discussions. Some of the discussions are very difficult. I am the chair of the DEI Council at Providence St. John's. In the past 2 months, we have had conversations about Palestine and Israel and Russia and Ukraine. Those are very difficult discussions, but no one walked out of the room because we have created a safe space to have those conversations, and we respected each other's opinions, and at times we agree to disagree. We need to create those spaces to talk about the issues for the different cultures. We need to lead by example. How do we lead by example? Be an ally to a group that you're not a part of. Advocate for them. Be part of their meetings, be part of their conversations. And I take this opportunity to share bystander interventions that has helped me a lot. So if you are a bystander and you overhear inequities going on, if you hear injustices going on, if you hear someone being yelled at, you as a bystander can do something. The 3 Ds of bystander intervention. First is to distract. You do not necessarily need to be part of that conversation. You can just say, guys, I can hear you. Maybe we can have this conversation somewhere else. Or you don't even need to let them know or to talk to them directly. Do something, make a noise, let them know that you're there hearing their conversations, right? Distract is the first D. The second D is to delegate. If you are afraid, if you are fearful for your safety as well, then please make sure to get someone who can help. Delegate it to someone else. Distract, delegate, and if you can, and if it's safe to do so, you can also directly intervene. Just letting them know that you're present, that you've heard the conversations, is leading by example and is helping that person on the other side of the injustice. I've talked about creating safe spaces. We need to do more of those platforms and conversations. We need to participate in training and development. We've had 4 years of nursing education, probably have had a semester on advocacy, but there's a lot of organizations and groups that talk about how to do advocacy better. Take the advantage of that. There are groups that may provide classes on media response training. If you get invited to talk to the media, if you really get invited to give a quote for an article, for a newspaper, the first thing you do is to say yes and then figure out what you'll say later. Because if you don't respond, someone else will. And our colleagues in the media industry are all bound by deadlines, and sometimes their deadlines are measured in terms of hours and not days. So say yes first and then think about what you will say later. But you can only do that if you have been trained as a media response nurse. So participate in all those opportunities that may be available to you. Let's amplify the marginalized voices. Like I said earlier, let's speak with them and join them and amplify their voices. Seek their feedback. Are we doing enough to help them? Very important to make sure that we get back to them and ask them how we're doing in terms of assisting them. And lastly is to be persistent. A lot of these changes that I'm asking from all of us right now takes a lot of time. So we choose to go to the moon. Health equity is not an easy job, but I will just go back to this statement from 1969, I think, from John F. Kennedy, when he said, we choose to do this not because it is easy, but because it is hard. Because the challenge is one that we are willing to accept, one we are unwilling to postpone, and one which we intend to win. This was in reference to the moonshot in 1969. Health equity is nursing's moonshot in 2024. We should choose to go to the moon. This is an image of the organization where I work at, and we did this last year, around this time last year, to promote Colorectal Cancer Awareness Month. And when we invited pastors from the Black churches in the Los Angeles area, if you're an oncology nurse, especially here in the US, you know that cancer affects African Americans and Blacks very disproportionately higher than all the other ethnicities and races combined. They have very low participation rates in screening, in cancer screening. So this was a big push using Black churches and the pastors of the Black churches to speak life by encouraging their members to undergo colorectal cancer screening. I have a video, but I am not going to share that, where I have Dr. Anton Bilchek talk about this program that is in partnership with uh, I am blanking on the organization's name, Stand Up for Cancer. And this was initiated after, you may recognize the name, Chadwick Boseman. And if you don't recognize the name, the Black Panther. After Chadwick Boseman died from colorectal cancer, I gave Chadwick Boseman his first cycle of chemotherapy at St. John's a couple of years ago. He was our patient. He was in our hospital. I'm not breaking any HIPAA laws right now because the video that I was going to share is on YouTube, publicly available to everyone, where Dr. Bilchek talks about how Chadwick Boseman wanted to promote colorectal cancer screening so that a lot more of the African American community will take the opportunity to get screened. So I've said a lot of things. I think I took a long time doing that. But my call to action for all of us on this call, hopefully all 10,000 of us, what is our role? What is our role as a nurse in the country where I am at practicing right now? How can I help reduce the gap to achieve health equity? As I said earlier, it is a lot of work, but we're not going to get the work done unless we work together. And working together, the Filipino way, bayanihan, all hands on deck, is what we need. Is what we need right now. We cannot delay it. The work is important. The work needs to be done. And with that, I thank you for your attention, and we'll be looking forward to the reactors and maybe potential questions if we have time from the audience. Thank you very much.
Thank you very much. And a big round of virtual applause, please, for Dr. Saria. And thank you for sharing your insights on global health challenges and the role of Filipino nurses worldwide. And now, ladies and gentlemen, to discuss the keynote, please welcome Patricia Punzalan, the Senior Director for Patient Care Services at Dignity Health San Francisco. Joining her is Dr. Patria V. Manalaysay, President of the Pacific Nursing Service Organization. Your reactions, please. And we would also like to request our attendees to please comment or type in your questions for our open forum after this discussion. Thank you.
Oh, thank you very much, Joe Fred. Good morning, everyone. Can you hear me? Okay, perfect. Thank you, Dr. Saria. I can see you're nodding your head. So thank you for acknowledging. So I really, really am so pleased being part of this. To your point, we would like to definitely extend our thank you to all the organizers of this particular webinar, first of all. And being with you again, this is my second time joining the Filipino Diaspora webinar, and I am grateful again to Dean Aris for trusting me to be part of this. Dr. Saria, I am very, very impressed with your presentation because of so many things, right? You were able to somehow discuss the concept in its basic level and yet very, very insightful. You have shared so much, not just the information or valuable information, but more so your personal experiences that they definitely translate your passion towards this work. So thank you very much. I'm gonna make my reaction quick because I'm sure we want to make sure that we have enough time for the question and answer. There are two things that resonated well with me in your presentation. One of those is actually when you mentioned something about this quote from a movie, right? Which speaks so much about the quality of life and how you also define yourself what quality of life is, right? The reason why it resonated with me is because I came across a paper that was actually published by the Center for Health and Happiness. This is quite interesting because it speaks so much about how should we be equating health with happiness, right? It seems that this paper is trying to highlight that in as much as GDP is a common measurement of how well a country or, a country is economically being measured, right? And for those people, I'm sure our students know this very well in the audience, that the GDP or the gross national product is actually a computation of the accumulation of all the individual income of businesses, right? However, there was this argument that speaks about how inaccurate GDP as a reflection of the progress of a country, because the person who was actually arguing this said that in the GDP, you're not really measuring the other aspects of the quality of life, which includes, those unpaid labor. You spoke about inequity, right? There are some family child care that's also not measured, which also, in a way, can have some cost into it. And as well as other environmental damages, which is not even which is not even measured by it. So what is also interesting in this particular paper is how a lot of countries, not the United States where we are, Dr. Saria, sadly, right, have been moving towards this work around pushing policies that would somehow create an infrastructure about redefining health and well-being through measuring happiness, right? And one of the recent theory that was presented, which I'm going to be quick, it's this particular theories created 5 building blocks of well-being, which is based on the acronym of PERMA. And PERMA stands for positive emotion, right? Which speaks about gratitude and forgiveness, right? We've been pushing about always find time to be grateful. And I think you mentioned that as well in partly in one of your presentation when you were speaking about well-being as well, right? Like taking care of yourself. And I think that's one of your focus in your introduction. E stands for engagement, on how we participate in activities, which you also mentioned as well, in terms of being involved and making our life more of a flow, right? And continuous flow. Relationships is another building block for well-being, which involves social connections. Meaning is very, very important. And I think the reason why you're also part of this discussion, and I'm sure because of that meaning aspect in our profession, right? Finding the higher purpose is important, connecting the dots for what we do every day to the bigger goal. And also about accomplishments. That's another, term for that term. So the other point that I'd like to also share that resonates with me is when you spoke about equality and equity. I know you explained this very well, and I am very, very impressed with those illustrations that you made and how you were able to really define each of those and be able to somehow make us see it in a different light. And one thing that really stuck in my mind when we speak about equity, equality, justice, and everything is about implicit bias, right? It's another concept that is being introduced so much more now. And it's very important to recognize that there is what we call implicit bias, right? The Joint Commission even defined this and even speak about how frightening this concept is, because as we know, especially in the United States, that we have seen this, and there have been so much examples on implicit bias in healthcare, where we found that there has been a lot of non-white patients that believe to have fewer cardiovascular interventions. And to your point, the transplant, right? You were speaking about equity on transplantation. It's very obvious. And part of that is actually that concept of implicit bias. And then we know that there are a lot of Black women or people of color who die of breast cancer, diagnosis and all that. Black men also receiving less chemotherapy. Some patients who are people of color, they are receiving less medications when it comes to pain, right? There is bias when it comes to that, right? Recently, we were actually in I'm not going to disclose as well, HPI, right? We have this case of a particular patient that we had an issue on in terms of safety, that we were reviewing a video on, and how I live in San Francisco, and I'm not sure how familiar others are, and I'm sure you are, Marlon, that we have this high incidence of substance abuse disorders, right? Especially in the Bay Area. So with that being said, it's not uncommon for us to receive these types of patients in the emergency department. And there was this one video we are reviewing because the patient came into the emergency department. He was saying that he came because he just wants to take a shower, okay, but he was having difficulty of ambulation. And the EMS who actually took the patient to the emergency department also mentioned about his difficulty of walking. However, the person is so disheveled, the look of a typical substance use disorder patient. The patient spent only a few minutes in the emergency department. We can see in the video, people were actually distant from him, right? They're stepping like they're few feet away, and you can't imagine how they're doing their assessment few feet away, right? Patient was discharged. Patient actually came out of our emergency department unnoticed, and then we found him dead at 3 a.m. in the morning, right? So again, I'm not saying that we caused the death. It's just that it's so disheartening that there is that we felt that part of that could be that bias, right, in these types of patients. So again, thank you. I want to give, of course, some time to Dr. Manila Isay to also give her reaction. Again, Dr. Saria, it's a pleasure hearing your lecture, and I hope we can actually connect at some point here.
Thank you, Dr. Ponsalan.
Thank you very much, Dr. Ponsalan. I bring you now to Mindanao, Davao City, in the southern part of the Philippines. A change of venue, a change of location, but I guess there are some similarities to what Dr. Saria also has mentioned in his talk earlier. Good morning, ladies and gentlemen. Thank you for giving me this opportunity to share my thoughts on the topic bayanihan. And I would like to go back to the pronouncement of the WHO in 1946, subsequently in 1966, and also fast forward to the Human Rights Declaration as mentioned in the Philippine Constitution. In the 1987 Philippine Constitution, it was mentioned that the state shall protect and promote the right to health of the people. Health is a fundamental right of every individual. And while the framers of the Philippine Constitution have expressed their intent at that time, the Filipino Nursing Diaspora Network also has a very strong declaration of principle as far as health is concerned. The thrust now is to enhance healthcare roles of nurses to become more preventive and more promotive in orientation. To echo Dr. Dennis Batangan's study entitled Addressing Community Needs Through Public Health, technologies. It can be observed that we also recognize the primary responsibility to preserve health such that it can be observed that the value of life is translated more importantly as a sense of social responsibility to also help others, be it promoting health, preventing diseases, serving justice, providing love, or having a peaceful community, as well as social access and equity to healthcare services. So nurses took oath to have this social responsibility and continue to care for those who needs care as advocates in whatever way. It was mentioned by Dr. Saria, the role of diaspora communities in addressing unmet health needs, especially in time of the health crisis in their adapted and origin countries. And born out of this commitment to support and commit to the establishment, to start our commitment to FAAN's mission to support and connect the Filipino nurses abroad, we established in November 2023, the Pacific Nursing Service Organization Incorporated to journey with the Philippine Nursing Diaspora Network. The Filipino Nursing Diaspora Network participates in the attainment of full health potential of every Filipino so that no one is disadvantaged because of socially determined circumstance. In the evolution of health sector reforms, we can also rely on the participation in the functions of the health system like that of the Filipino Nursing Diaspora Network and other public health campaigns, not only here, not only locally, but globally, especially in the advent of e-health. We have now the COVID repository here in this part of Mindanao, and we intend to introduce to every school, every educational institution from north to south of the Philippines so that they can access all research outputs of faculty and students from the different schools from north to south. And looking at healthcare using the health systems approach, Dr. Batangan and other researchers show that there are strategic ways of addressing the health concerns of a community where we belong anywhere in the world in order to achieve better health outcomes. One is through leadership and governance. The collective effort. Another is the use of platforms for accessing verified health information and using platforms for stewardship and synergy, which are mechanisms for horizon scanning. Therefore, we should link individuals who are leaders, who are aware, better informed, and actively engaged in health innovation and technology. We should also, at the same time, support each other as healthcare providers, as what was shared to us by our keynote speaker, to effectively decide and deliver integrated models of care through access to best education and training. We should push for smart, transparent, and efficient healthcare delivery, administration and management, as well as service planning. In moving forward, we would like to invite you all to join us, join the Filipino Let's gather to help our fellow men. Encourage you to together find meaning as we share our time. Love and being friends. Through the Filipino Nursing Diaspora Network, working to stay on top of emerging nursing as well as healthcare trends, discover practical solutions to implement in the workplace, and assist you in your continuous education. In behalf of the Pacific Nursing Service Organization Incorporated, I would like to express our profound gratitude to Filipino Nursing Diaspora Network for the opportunity to contribute to the dialogue, and to all of you out there for being one with us in this endeavor. I sincerely commend the organizers for facilitating this important discussion. Thank you very much, and congratulations to the Filipino Nursing Diaspora Network. Thank you very much.
Thank you as well to Dr. Patria V. Manalaysay, the President of the Pacific Nursing Service Organization. Likewise, to Patricia Punzalan, the Senior Director for Patient Care Services at Dignity Health San Francisco. Thank you for giving your reactions to the keynote of Dr. Marlon Saria. Again, we would like to remind our attendees, if you have any question in mind regarding the keynote and the reactions, kindly type in your questions in our Q&A box. And before we move on to our open forum, let's enjoy a short performance by a nursing student of St. Anthony's College, Miss Christine Jane Asmod. Please stay tuned.
Good day, everyone. My name is Christine Jane Asmod, a student nurse from St. Anthony's College, and I'll be singing I Can. I can live, I can love, I can reach the heavens above, I can right what is wrong, I can sing just any song, I can dance, I can fly, and touch a rainbow in the sky, I can be your good friend, I can love you until the end. What took you so long to make me see how lucky I am, 'cause I am free, free to do the things I wanna do. What took you so long to make me feel I can give love, a love so real? What took you so long to let me know that I can live, I can love, I can reach the heavens above, I can right what is wrong, I can sing just any song, I can dance, I can fly, and touch a rainbow in the sky, I can be your good friend, I can love you until the end. It took you so long to make me cry, so I will know the reason why I'm so lucky I could smile. I didn't know it's for a while. I can live, I can love, I can reach the heavens above, I can right what is wrong, I can sing just any song, I can dance, I can fly, and touch a rainbow in the sky, I can be your good friend, I can love you until the end. can fly and touch a rainbow in the sky. I can be your good friend. I can love you until the
Thank you very much, Miss Christine Joy Asmod, for that wonderful song number. And now we open the floor for questions from our participants. So again, please feel free to submit your questions through the Zoom chat, or please, if you are in our Zoom platform, please raise your hand to speak. And we have here a question. May we request Dr. Marlon Saria to please open your camera. Likewise to Dr. Patricia Punzalan, and Dr. Patria Manalaysa is already here in our Zoom platform. Here is a question coming from Japeth James Dagaang. What do you think is the greatest challenge for our colleagues who choose to continue to practice in other countries like the United States of America? Again, what do you think is the greatest challenge of our colleagues who choose to practice in other countries like the USA? Doc Marlon?
So that's another very loaded and very complex question to answer. There's a lot of factors and variables that impact decisions of our nurses to practice in other countries. Economic is one. Like I think it's number one on top of most of our lists. We look for greener pastures by going to other countries. And it's very difficult to manage because we are talking about human rights, and health is a human right. Movement is a human right as well. So every human has the right to go anywhere in the world that would accept them. So it's very difficult to enforce or enact laws that will prevent migration. We cannot legally. I don't know. It's maybe we can have this as another webinar because this definitely is very complex and will require a lot of experts. That's probably not my wheelhouse right now.
Thank you very much, Doc Marlon. Can we have insights coming from Doc Punzalan and Doc Manalaysay? Any comment on this question?
As far as I think, okay, hold on, because I'm having some issue with my. Oh, I'm having some echo because I'm also using my. Okay, did it work? In a way, okay. Too many devices at the same time. I can't actually use my camera, so I use my phone on the other side. Okay, so just like what Dr. Saria stated, it's a loaded question, right? The challenge, I would say, is more around cultural integration from my perspective, right? What I have seen thus far, and we are very, very proud to say that. Again, this is just my world, speaking about how I view things. We are, when it comes to our ability to immerse ourselves in other countries, in any kind of workplace, we are known to be one of the best people when it comes to that, right? We excel in a lot of things across different professions and all that. So I don't think that's a challenge for us in terms of adjusting to the conceptual work of nursing itself. But I think what is challenging is that implicit bias that I've spoken to, right? I never realized that I am different in this country until I felt I'm different, right? So, and navigating through that is definitely one of the challenges that I personally has to navigate through successfully, right? I need to be able to speak up. I need to be able to be comfortable, to somehow stand my ground and make sure that They know that I am confident with what I'm doing, with what I'm saying, with what I know. So for me, basically that's one of the challenges in working in in a country that's outside, of course, of the Philippines. So
Yeah. Okay. I guess the the most challenging thing is basic, the motivation of a person, the individual, because we have a lot of opportunities. We have education ready, we have trainings, we have developmental goals, and it will only boil down to the motivation of the individual. If right from the very start, there is that heart to be altruistic, you give more in everything that you do, you'd be able to share your time, your talent, and most of all, your services. So if we plant a seed in every student that we have in the schools of nursing, perhaps we can rely more that the future will be something that will be great in terms of services coming in from the nurses that we will graduate. I guess we'll have to focus more on the motivation of the individuals so that we'll be all directed towards the accomplishment of one common goal for everyone. That's all. Thank you.
I
Thank
think
you
I'd
very
like,
much, and
sorry, Joffrey.
thank you for sharing your ideas regarding the challenges faced by not only Filipino nurses but nurses in the U.S.
Yeah.
We have here another question. What advice can we give to young Filipino nurses aspiring to create a difference in global health? So again, coming from our nurse leaders, what advice would you give to young Filipino nurses aspiring to make a difference in global health?
Can I start sharing? I think the best thing to do is start young. When the kids enroll in the Bachelor of Science in Nursing program, since we focus more on leadership and management, I guess they have been oriented well to how to become leaders of the future. We just have to enhance and model to them as administrators of the different academic institutions that there's a need for them to come out of their shell. They have to share everything that they know and continue to learn, because nowadays we have to engage in lifelong learning, continue to be relevant at all times. Thank you.
Thank you for that, Doc Manalaysay. Indeed, no, the nursing curriculum prepares our nurses to be able leaders and good in managing healthcare services when they reach the clinical setting, no, as professional nurses. And there, in the clinical settings, professional nurses may mentor, no, our young nurses to help them become good leaders, thus making them more relevant or responsive to the needs of the healthcare industry. Doc Marlon, would you like to add to that?
Yes, but before I answer that question, I have to say that I misunderstood the first question, and I realized that I misunderstood the first question when Dr. Punzalan started responding to it. I love stories. You heard that from my keynote earlier. So when you migrate to another country and practice in another country, I've heard before someone told me that nursing is just like riding a bike. If you know how to ride a bike in the Philippines, you'll know how to ride a bike in the United States. True. But when you go to a foreign country and you're riding a bike, the bike is on fire, you're on fire, the street is on fire, and everything else is on fire. So it becomes much more difficult. Riding that bike is a lot more difficult when you're in a foreign country. So that's the biggest challenge for me is those first couple of months to years, and then just getting integrated as Dr. Punzalan alluded to. So that was a perfect answer, Dr. Punzalan. It's just the adopting to that country, and not only the day-to-day life, but the practice as well, because nursing is very different. The technology is different. It's adopting to that. To this question, you stole my thunder, Joe Fred. I was going to say it's all about relationships. You know, for someone who wants to do something big and someone who wants to make an impact, talk to the people who are already doing it, right? Find a mentor, find someone who has done it. They will pull you up, and it will be a lot faster for you to get to where you are if someone's pulling you up already to where they are. So that's my biggest advice. Find a mentor, and you can find those mentors from the professional associations. So sign up with PNA, sign up with your local Philippine Nursing Association in your country, sign up with your specialty organizations, and then you will find the mentors who will pull you up there and get you to do whatever it is that you're passionate about.
Thank you for that, Doc Marlon. Indeed, the mentorship is very important to cater to our professional needs. Going further with what Doc Marlon said about joining different nursing organizations, let's talk about the Filipino nursing diaspora. FND is already here. So since most of the panel here are also members of the Filipino nursing diaspora, how can Filipino nurses foster collaboration through this organization all over the world for Filipino nurses to be linked with other nurses working or currently based on other countries like in the US? Doc Patricia Punzalan, would you like to comment on this?
Yes, as a matter of fact, one of the members of the Filipino diaspora reached out to me recently, and I think Jerome actually was able to link that person to me. And that's one way, right? Being active in this organization and asking the right people for information, because I'm sure all of us are actually willing to share our own information so long, because our desire is for us to be able to be of support to anyone who is interested to reach out. So, I've always believed that networking now is actually a critical skill, right? Being able to know all of these things around social network and all that. It's one way for you to leverage in getting the right people who could actually provide you the assistance that you need, right? Jerome, I think, has all our
The
information.
FAAN
Go ahead.
network has advisory board members from different parts of the world. And these people can be contacted through their associations. And what we wanted to do in our network is, again, most importantly, to link everybody. That's why all this advisory network from Europe, from US, Asia Pacific, Philippines, and UK, and other countries, and even in the Middle East, including India and Nepal and all those Southeast Asian countries, are worthwhile collaboration initiatives, not only in curriculum development or review, but also in developing new education to prepare nurses for migration. As a professor in a university, we have a lot of PhD students looking at motivation of migrant nurses, Filipino nurses, the issues that they face, and what are the difficulties and challenges, and how we can support them. So counseling and psychological support for migrant nurses are really, really important. And that's why, we were talking about challenges when a nurse migrate. It is important that they are prepared for migration before they actually move out. It's not only looking at how they will progress in their professional career and for financial gains, but what is it that they actually want to do when they migrate to a different country. And as what Dr. Saria said, mentoring is actually very important, and networking and being able to find somebody who can actually help them. And migrant nurses actually can learn a lot if they move to a country and settle in one of the family in the host country, because being a person living with a family in a host country actually helps in terms of acculturation. We know we have a lot of studies about nurses who cannot acculturate to the host country. And some of the issues also are those migrant nurses who moved to another host country and then they were not satisfied and they moved to another host country. So it becomes a stepping stone from where they want to move. And these nurses who migrate from one host country to another also needed some support, why they move and how they will settle down in another country. Because I have known a lot of nurses who moved from the Philippines to Saudi Arabia and then went to Ireland and now in Australia. And then within Australia, they moved to the different states in Australia. So yes, they need a lot of support. And the Filipino
Thank you for
nursing
that, Dr.
diaspora who
Violeta
is
Lopez.
been developed is actually trying to connect all the migrant nurses into one network. And through that, we can actually collaborate and support. And connectivity is one important aspect of the network.
Thank you very much, Dr. Lopez. Dr. Lopez is the president of Filipino Nursing Diaspora Network. And thank you for the work of helping our nurses, especially those working abroad, to be more connected, to have a network wherein they can feel that they are mentored and supported in the nursing profession. We are also
And I
fortunate.
actually acknowledge
Dr.
all
Marlon
the
Saria is the
Filipino nurses
president-elect
working
of
overseas
the
that
Philippine
goes back to the
Association of
Philippines and
America.
help the
Doc
nurses.
Marlon, any insights of how also PNA of America can also help our nurses, especially there working in the US?
Yes, so we have 55 chapters in the US. There are a few states that do not have chapters of the Philippine Nursing Association yet. But the 55 chapters are very active in welcoming brand new immigrants to the US on a working visa. One of our chapters, the PNA Metro DC, District of Columbia, and in Washington DC, uh, just started a welcome program. It's a very robust program to assist the immigrants coming here, because there's a lot of things that you don't think about. Yeah, it's like I said earlier, it's not learning how to bike in the Philippines and then bringing that bike in the US. It's not that easy. You have to establish a bank account. You have to you have your social security, and then all that in addition to learning your job, right, in the first 3 months of coming here. So the Philippine Nursing Association of Metro DC has established this program to assist those nurses through those crucial months, to how to live in the US and how to work in the US. We have those programs that are available, and we're looking to partner more with other agencies to be able to do a lot more, and maybe even bringing it back, which some may not like hearing this, but bringing it back to the Philippines. So before they even leave the Philippines, they're already being trained on how to live here. I know, like I said earlier, that's might be controversial, but that's where we're going in terms of thinking about acculturation and training for those coming here.
Thank you
Doctor, if
very
I may
much,
just
Dr. Marlon,
add,
for such programs of helping our nurses just by simply assisting them how to open their bank accounts, guiding them in their first 3 months there in the US is really a big help, especially for those who are new to the place. And we've been talking about the challenges encountered by our nurses in the US or in the other countries. Here's a question coming from J.R. Santome. Going back to the Philippines, what do you think should the government do to address the depleting number of nurses in our country who choose to work abroad? Now, let's talk about our challenges here faced by our, not by nurses, of course, nurses that are left here, but by hospitals, which suffer from depleting number of nurses who choose or opt to go or work abroad. Anyone who would like to give a comment on this? Yes,
Actually,
Doc Manaysay.
Joe Fred, the government is doing a lot of things not to help increase the enrollment of students in the academic institutions in the colleges of nursing. In fact, that is one of the main topics we have discussed with the Board of Nursing during the ADPCN conference, summer conference. And they're coming up with ways to address the faculty requirement, which is one of the things that we would like to address nowadays, because we know that we have kind of changed the qualifications of faculty who can supervise students in the clinical area. So I guess soon the Commission on Higher Education will find ways to help faculty requirement ease the burden in the enrollment in the different schools. There were times in the past wherein we were faced with so many nurses, but there were no nurses working in the hospitals. No, we have a lot. We have actually graduated since the 1970s. 900,000 nurses in the Philippines, but they cannot be found anywhere in the hospitals. That's why we have a dearth of nurses working in the hospital, especially now that the new generation cannot work. So sad to say, they're not so used to working very hard, just like the baby boomers during our time. No, that is not their fault, of course, because it's the environment where they are now attuned to. So this challenge about faculty requirement is being addressed by no other than the Philippine government, and Prospero de Vera, who heads the Commission on Higher Education with the Technical Working Group for Philippine Nursing Education. They're trying to come up with ways to address this. And for sure, they will not be keen on sending our nurses abroad right away, but we would like to, contain them here first in the Philippines because we need them. But we cannot stop them from leaving the country after they have that necessary clinical experience that they would need when they face the challenge of working abroad. That's all.
Thank you very much for
I hope I have answered your question.
Indeed, our Philippine government, through the Professional Regulatory Board of Nursing, together with our accredited professional organization, the PNA, and with other organizations, are working hand in hand, such as those for the education counterpart. The Association of Deans of the Philippine Colleges of Nursing are also helping in creating or developing nurses from their education to be more competent in entering the workplace.
That's
And
right.
there are several programs for retention are also planned to retain our nurses in order to guarantee that there will be nurses working here in the Philippines. Doc Punzalan, any comment on this also?
Yes, actually, recently I've read something about this discussion because I think.
Doc Punzalan, can you request to please open your microphone? I think you're muted.
Am I muted? Can you hear me? Okay. So I read something. I think Dr. Saria might be the expert on this than myself, but what I know is that this is actually a global discussion, not just within the Philippines, right? Because of the concern of really depleting and doing some kind of an injustice to those countries where the nurses are coming from, right? Because the opportunities is not only open to the United States, as we know, right? It's all over. However, a lot of our graduates are coming to those countries, and there is this discussion around how can we also support those countries who are supporting us with nurses. I think that's very, very important. It's a global issue, and I am actually happy when I saw that, because it's not just about us getting the benefit of our qualified and competent nurses, but they're also concerned about making sure that there is also equity in terms of providing those resources to other countries. So I think Dr. Saria would like to add something. I think you must be very familiar with that, discussions, right?
Yes, so one of the things that I heard from the last global summit in Iloilo in January with the ADPCN, PNA, and PNAA was Dr. Divina Gracia making a recommendation, because that stood out to me. And basically what she said, and if she's listening, if I'm misquoting her, please forgive me. But I think she said, you know, we're doing the same things that we're doing, right? And we know that they're not effective. So she's making some recommendations, and believe it or not, Dr. Punzalan, you actually alluded to one of her recommendations. Is she was saying, why don't the recruiters and the agencies who are hiring our nurses abroad, why don't they pay the organizations in the Philippines for every nurse that they take? Like, it sounds bad right now, I think, because we're paying, position per position. But if you think about her rationale, it's paying so that the institution that lost that nurse can grow more nurses and develop more nurses who can stay and grow and help with the clinical shortage in the Philippines. So again, that's an opinion that I heard. I don't know where we're going with that. But one of the things that Dr. Punsalan said, this is a global issue. And I've been at the table with conversations from African countries who are now going through the same things. That many of the African nurses are coming to the US. And if you look at the ratio of nurses to the population of their countries, that's depleting rapidly because of migration from Africa as well. So it's not just the Philippines; it's a bigger discussion that it's beyond all of us at this call right now.
Thank you very much, Dr. Saria. Doc Manalaysay, would you like to add?
Regarding challenges, still challenging challenges to our nurses. I guess we really have to do something about current issues. In the Philippines, we vary with regard to relevance, no, especially in answering issues related to the nursing education. So we come up with something very competitive, comparable to the curriculum that other countries have. So we always stay on top of the others. And needless to say that our own graduates would like to work abroad. So we have to, at the same time, prepare them. In fact, as mentioned earlier, we have one subject, one course related to decent work, which is included in the curriculum, the BSN curriculum. So this is what we would like to come up with and talk about, and the things that the students need to know when it comes to contracting jobs abroad. So to prepare them for what is in the future. So that's all.
Thank you very much, Doc Manalaysay. It has been an engaging discussion together with our keynote speaker, Dr. Marlon Saria, together with our reactors, Doc Manalaysay and Doc Punsalan. Thank you very much for your insights and sharing with regard to our theme for this year. And now we would like to award a certificate of appreciation. First, to our keynote speaker. A certificate of appreciation is awarded to Dr. Marlon G. Saria for sharing his invaluable time and expertise as keynote speaker during the 2024 Filipino Nursing Diaspora Day webinar with the theme Respecting Rights to Secure Global Health. May 11, 2024 via Zoom webinar and Facebook Live. Signed, Dean Aris Kendall Arbongabong, Nursing Dean St. Anthony's College and President of ADPCN Region 6. Signed, Professor Violeta A. Lopez of the FIND Network President. Ladies and gentlemen, a big round of virtual applause, please, for Dr. Marlon Saria. Can we hear a short message coming from Dr. Marlon Saria? Perhaps a closing message to all of our participants in this Zoom webinar and Facebook Live as well.
So thank you again. Thank you to the Filipino Nursing Diaspora Network for this opportunity. Thank you for inviting me. And thank you to all the attendees and all the panelists at this conference for a really informative conversation. My hope is that we continue the conversation and get the work done. So let's all magbayanihan tayo. Let's all work together, all hands on deck to get this very important work done. Thank you.
Thank you very much, Doc Saria. The conversation does not end here. Again, as you already called it challenge, magbayanihan tayo. Let us work hand in hand, not only Filipino nurses working abroad, but as well Filipinos working here in the Philippines. We would also like to award a certificate of appreciation to our reactors in our keynote address. A certificate of appreciation is awarded to Dr. Patricia Punzalan for sharing her invaluable time and expertise as panel reactor during the 2024 Filipino Nursing Diaspora Day webinar with the theme Respecting Rights to Secure Global Health. Once again, a big round of applause, please, for Dr. Patricia Punzalan. The same certificate is also awarded to Dr. Patria V. Manalaysay for sharing her invaluable time and expertise as panel reactor during the 2024 Filipino Nursing Diaspora Day webinar with the theme Respecting Rights to Secure Global Health. Thank you very much to our reactors. Dr. Manalaysay, thank you very much. And before we come to a close, let us hear a message coming from our friend Abigail from Shearwater.
Hi, good morning, everyone. Good morning to all the nurses. I will keep this short. It was a very invigorating discussion we just had from our panelists and our reactors. And I will be speaking on behalf of Shearwater Health, which is a company that strives to address all the issues that they talked about. These are very important issues. They were speaking about your motivation. What do you want to do? What do you want to happen for your life as a nurse? Do you want to stay here in the Philippines? Do you want to work abroad? As a company, how do we address that here at Shearwater Health? What if you want to ride the bike with everything around you burning down? How do we help address that? So I'm going to share my screen and I'll try to keep this as short as possible. So just a quick company background. Shearwater Health is an organization which provides expertise in global healthcare solutions to improve clinical services. We are a clinical process outsourcing company, or a CPO, which is not a very known field to a lot of nurses. A lot of our nurses are still under the impression that their option is only to work bedside. There are a lot of other options for you because there's a lot of stuff going on in the background that helps hospitals and other healthcare organizations provide care and healthcare solutions. We concentrate on the healthcare market, and our mission is to improve healthcare outcomes globally. So we are tackling this not just here in the Philippines, but also in the United States. I will be speaking a little bit about that later on. And we are also looking to start another program to bring Filipino nurses to the UK. With that in mind, our vision is to become the leader in efficient, scalable, and accessible healthcare solution provider through our values, which is integrity, commitment to service and excellence, ownership, respect, and entrepreneurial spirit. The logo of the Shearwater Health Company is the Shearwater bird, which is, I think, in line with diaspora, moving from where you are to somewhere else. In the case of our nurses, to provide healthcare solutions worldwide. And right now, We have 4 corporate offices, one in Nashville, Tennessee. We have a very big presence in the United States with clients in approximately 20 states. We have production offices in Taguig, in Cebu, and in Pampanga, which recently opened. But we actually have nurses working from all over the Philippines. We have nurses in Davao, in Baguio, and since for some of our accounts, we either have a work from home or a hybrid setup. This also allows our nurses to stay where they want to stay. If they want to stay in Laguna, in Cavite, wherever they are from, it doesn't stop them from being a nurse. And to echo what our keynote speaker, Dr. Marlon, was talking about, what is the U.S. nursing landscape right now? There is a need for more than 1.5 million nurses just to address the need for nurses. And I think during the pandemic, that was highlighted even more. And not only that, in the next 5 years, 1 million more nurses are retiring, which kind of echoes what our speakers and reactors were talking about a while ago. There is a need for a lot of nurses. Not a lot of people are taking nursing courses now, and a lot of the experts, a lot of the people with experiences are about to retire. There is an aging population. How do we address that? There is a nursing shortage growing nationwide, and there are 70,000 qualified applicants turned away from nursing school per year. That's not easy becoming a nurse. To just be accepted to nursing school is not easy, let alone graduate, pass the necessary licenses. What are we doing about those issues? And there are over 500,000 open positions in the nursing field with great growth potential for professionals. I think nursing is one of those professions where you're required to have a heart to actually really care. But at the same time, it can be very rewarding career-wise. Right now, we are in the presence of our speakers, and they have achieved a lot in their respective fields. So if you want career growth, definitely you are in the right profession. The U.S. nursing shortage is expected to continue into the next decade. So that's what our company is looking to solve. We're not just looking a year ahead, 2 years ahead, we're looking 10 years ahead. How do we address all of these issues? And in the Philippines alone, our Department of Health Secretary stated we would like to stop the bleeding as soon as we can. One of our reactors a while ago said that a lot of Filipino nurses, the moment they graduate, they're on the fast track. Take the Philippine licensure examination for nursing, take NCLEX or whatever other exams are required for them to go overseas. The United States, the UK, the Middle East, Australia, New Zealand. But what about the Philippines? We are also running out of nurses here too. So with all of that in mind, we have several talent development programs that aims to provide nurses with options. What if you want to stay in the Philippines? How can you guarantee that you make enough money to support your family? If you have a wife, kids, or you are the breadwinner of your family, is bedside really your only option? What if you found that like one of our doctors mentioned a while ago, you're not built to work hard like that, like the boomers are? What if you're more comfortable behind the laptop? Does that mean that you can't provide healthcare solutions? No. What about if you have plans of going to the United States? You dream about that, but you don't have the resources to take your NCLEX. Reviewing for an NCLEX is a lot of pressure. It's another exam. It's a lot of pressure, takes a lot of time, a lot of money. What if you don't have the necessary funds to make that happen? What are you going to do? Does that mean that you are stuck here? As much as you want to be a nurse in the Philippines, we are looking for greener pastures. So what do you do? So we have several talent development programs here at Shearwater Health. One of them is partnering with nursing universities and, of course, other industry partnerships like hospital partnerships. And one of the things we do is hope to include healthcare informatics in curriculums of schools. We have a very strong partnership with FEU right now. And we also have scholars programs to provide tuition assistance to future nursing graduates to join Shearwater Health as employees. You're almost there. You're about to graduate. Suddenly, you don't have enough money. What are you going to do? So we aim to assist nurses with that. And not only that, provide them with employment afterwards so that you have career and job security. We also have several clinician staff development. I think this was also stated a while ago. We live in a world where you have to continuously learn. You can't stop learning. If you stop learning, you stop growing, and you don't get anywhere if you do that. So we have several Shearwater Health Academies in-house, and we also have the Nurse Compass program, which I'm going to touch on a little bit later on. And of course, Philippine Employee Engagement and Recognition. In 2023, we are recognized as the top Philippine healthcare outsourcing employer. And we have several outreach and community programs to also help promote corporate social responsibility. Right now, as I mentioned a while ago, we are partnering with FEU and the University of Cebu. We have 67 scholars. We have 61 nurses who graduated nursing, and 19 of them have passed their licensure examinations. And we also partner with several hospitals here in the Philippines. Right now, we have 19 approximately partner hospitals where we have what we call the back to bedside program, because we need nurses here in the Philippines too. And aside from that, we have the Shearwater Health University, where we have several learning programs. For those of you who have found that you do not have the heart to work in the hospital setting, that does not mean you have to stop being a nurse. We have several accounts that handle different processes that happen in the background. You can be a lead here, you can be a quality analyst, you can be a trainer, and we provide training to make sure that you are prepared to take on those roles. And not only that, we also provide Lean Six Sigma ladderized training. These are Excel trainings, yellow belt and black and green belt training, supervised by our black belts. Now, if you do have plans of becoming a USRN, we have the USRN Academy. This is completely sponsored and open to all of our PHRNs, where we sponsor review. You don't have to pay for processing. USRN license processing is covered by Shearwater Health. So is license endorsement if necessary. And I think what's good about this is, aside from sponsoring this, we provide you with options as to what you want to happen next. Right now, we have more than 300 scholars in the USRN Academy, and they can choose to join our Nurse Compass program. If you want to stay in the Philippines, and I think a lot of our nurses, a lot of Filipinos, not just nurses, if they have the option to stay in the Philippines and make good money and provide for their families, they wouldn't choose to leave. So if that's what you want to happen, you can be a part of our NCP program, have a stable job here, and never have to leave. We also have the US Bedside Path, and this is a full ride for all of our nurses. You don't have to spend a cent to get to your American dream, if that's what you want to happen. And we also help prepare you for that using through our Back to Bedside program, where you basically work with our partner hospitals without having to sacrifice your earnings. For those of you who have plans of going to the United States, one of the struggles is getting sufficient bedside experience, especially for those of you who have experience in the CPO setting. And we want to help alleviate that. So that way we are helping hospitals here in the Philippines, helping the nursing shortage here in the Philippines, but at the same time, helping you get to where you want to go. Where you want to go is the United States. Recently, we also launched a project for sending nurses to the UK. We are still finalizing that. So that's something that we are especially proud of, because it is something unique to our company. For those of you who are familiar with the CPO, usually their goal is to keep you there in the CPO setting, but a lot of our nurses have a heart to actually take care of people and be in the bedside, and hopefully at the same time make enough money to provide a better future for your families. We help make that happen, and we are not going to stop you from doing that, because not only does Shearwater have a presence here in the Philippines, we also have a presence in the United States, which allows us to fund your dream of getting there, and help the nursing shortage in the United States. But right now we have more than 160 USRNs part of the Nurse Compass program, with more than 300 people about to take their NCLEX. So this is a program that we are particularly proud of. A lot of our speakers touched on really important topics. I hope that when you think about those things, you consider looking into our company. Your success is our success. So it is very important that we, hand in hand, or in the spirit of bayanihan, tackle all these issues together while ensuring success for all of our nurses. So I am gonna stop right there. If you want to see our Manila site, feel free to scan the QR code that I am sharing right now. I am very honored to be a part of this conference, and I have learned a lot from all of our speakers. I hope this was insightful to everyone, and you all enjoy the rest of your day.
Thank you very much, Abigail of Shearwater Health. Thank you for sharing to us your programs and services, how to help our nurses aspiring to work abroad, and also those who opt or choose to work here in the Philippines. Thank you very much for partnering with us. Once again, ladies and gentlemen, Shearwater Health. Thank you very much, Abigail. And now to conclude our webinar, we would like to invite Dean Aris Kendall Arbongabong, Nursing Dean at St. Anthony's College and President of ADPCN Region 6, to deliver the closing remarks.
Good morning, everyone. Our distinguished speakers, esteemed colleagues, and fellow participants. As we come to the end of this informative and inspiring webinar, I want to express my heartfelt gratitude to everyone who made this event possible. Thank you to the Filipino Nursing Diaspora Network for allowing St. Anthony's College to host this year's Filipino Nursing Diaspora Day webinar. Today, we have explored the critical role of Filipino nurses in advocating for health as a fundamental right and the challenges they face in the global healthcare landscape. The insights shared by our keynote speaker, Dr. Marlon Saria, and the thought-provoking reactions from Dr. Patricia Punsalan and Dr. Patria Manalaysay have shed light on the importance of collaboration, innovation, and resilience in our pursuit of health equity and access. As we reflect on the theme of this year's Filipino Nursing Diaspora Day, respecting rights to secure global health, let us remember that our work extends beyond our individual practices. We are part of a global community of healthcare professionals, united in our mission to improve health outcomes for all. The Bayanihan spirit, which embodies our collective effort and unity, is more important than ever in the face of global health challenges. I encourage each and every one of you to take the lessons learned today and apply them in your respective roles. Whether you are a nurse, an educator, a researcher, or a leader in your organization, your contributions matter. Together, we can make a lasting impact on global health and create a future where everyone has access to quality healthcare. Once again, I thank our speakers, organizers, and participants for their dedication and commitment to this noble cause. May we continue to support and empower each other as we work towards a healthier, more equitable world. Thank you, and I wish you all the best in your future endeavors. Together, let us keep the spirit of Bayanihan alive in global health. Thank you again.
Thank you very much, Dean Bongabong, and thank you to all of our speakers, reactors, participants, and the technical team. We hope today's discussions have inspired you and broadened your perspectives on global health. Flash on the screen is the evaluation form. This webinar is accredited with 3 CPD units, and certificates will be sent to the registered email of the participants after 2 weeks. So please scan the QR code being flashed on screen for you to access the evaluation form. We'll be posting this for 2 minutes so that you can answer the evaluation form. So ladies and gentlemen, this concludes the 2024 Filipino Nursing Diaspora Day webinar. We appreciate your participation and engagement. Maraming salamat at magandang araw sa inyong lahat. May you request our panelists to please open your cameras. Let's have a photo op before we close our Zoom platform. Okay, Doc Marlon, Sir Jerome, Doc Punzalan, and Doc Wallace. Are you ready? Everybody smile. 1, 2, 3, smile. One more. 1, 2, 3, smile. Okay, thank you very much, everyone.